I'm Johnny Barton. I'm from Fort Worth, Texas. I'm 44 years old. I've had numerous surgeries in my abdominal for sarcoma, a rare cancer called liposarcoma, where I've had to have an incision, vertical incision, and sometimes a horizontal incision on my abdomen. I've been with this medical team here for most of that time, for 5 of the 6 surgeries. The recovery process is definitely very important. Dr. Sharif has performed 5 of the 6 surgeries on my abdomen that I've had, and I definitely have confidence, and I know that he's going to do the best for his patients. And I definitely can appreciate that. On this most recent surgery in January, I noticed immediately in the hospital that the wound was healing better and faster. I was able to get the staples taken out a lot sooner than any of the other previous surgeries. I felt great that it was healing, and that was something that I didn't have to worry about. I had other things that were on my mind at that time, and not having to worry about my incision and the way it healed was perfect for me. With a faster recovery time, I'm definitely able to get back to the things that I love to do. I like to be active, be outside in nature, biking, working up a sweat. Hiking has been near and dear to me. And then obviously getting back to work, when you're down for a recovery process time, getting back to those normal things is important for your mental health as well as your physical health. So faster, more speedy recovery is definitely better for me.
Mr. Barton is an amazing person. At the time when I first met him more than 10 years ago, he held the record for the biggest tumor I removed from a human being, from a person. It was more than 50 centimeters of cancer that he had intra-abdominally. Mr. Barton, over the years, unfortunately, because of his condition, has developed recurrences, and fortunately, we've been able to resect multiple cancers from his abdomen. When you have a patient like Mr. Barton, where you have to go back into the abdomen multiple times, now you have to go through this environment that has been operated on previously, that at this point has developed chronic inflammatory processes that portends poorly to wound healing. Because of that fact, one of the biggest things that we had to contend with Mr. Barton, despite having to remove multiple intra-abdominal organs and massive tumors in his abdomen, is chronic wound healing. He has developed surgical site infections in the past. He has developed seromas in the abdomen in the past as well, until his last surgery, which was last year. At this point, we were willing to deal with any consequences of wound healing because of the fact that he needed a surgery to essentially survive and live. As a matter of fact, that was the best outcome that he has had from all the previous surgeries in terms of wound healing, because in this case, not only did we have to go back into his abdomen through a midline incision, we also had to extend it laterally as well, because his tumor was so big that I could not just expose or remove it just through a midline incision. And despite having this complex crossing wounds, Mr. Barton actually did fantastic. I pride myself on trying to figure out what is the best thing that I can offer for my patients in terms of wound care, so that way the wound heals well. As somebody who believes in evidence-based medicine, I was skeptical, and no doubt about it. I was skeptical about the product, but keeping an open mind for the betterment of my patients, I wanted to give it a shot. What I've realized is the fact that their wound heals faster means they get to go home faster, which means their length of stay is actually shorter than what was defined by the National Surgical Quality Improvement Program's guidelines. I've seen it work on my patients, and my patients are very challenging. Not only my patients are immunocompromised, but they're malnourished as well and immunosuppressed. In this condition, these patients have to not only heal adequately, but also get to a point where they can get back on an immunosuppressive medication like chemotherapy. So not only do I have to treat them like somebody who does not have cancer, but I have to treat them to a point where their wound has to heal faster than somebody else as well. I would recommend this product to just about about any one of my colleagues who does any type of surgical procedure. My only regret is why I didn't start using it earlier, honestly.